The antalgic gait. The antalgic gait occurs when you walk with a limp because of pain. It's a common problem and usually caused by minor injuries. It sometimes, though, it can have a more serious cause. Pain is the main cause of antalgic gait. Anything that leads to pain in your lower limbs, spine, or hips can lead to an altered gait. The weak quadriceps gait. Quadriceps muscles extend the knees and are important for walking and balance. Quadriceps weakness may result from the pain of osteoarthritis. Knee buckling is the most common presentation of quadriceps weakness. The scissoring gait. The cause of the gait occurs when an upper motor neuron lesion links to the disorder. Legs flex slightly at the hips and knees like crouching, with the knees and thighs hitting or crossing in a scissors-like movement. This walking style can remind parents of a puppet walking or moving. The ataxic gait. It is usually caused by damage to a part of the brain known as the cerebellum. But it can also be caused by damage to the spinal cord or other nerves. It is often the first clinical sign of damage to the cerebellum and is also one of the most troublesome symptoms for patients. The hemiplegic gait. When walking, the patient will hold his or her arm to one side and drags his or her affected leg in a semicircle circumduction. Due to weakness of distal muscles, foot drop and extensor, hypertonia in lower limb. With ambulation, the leg moves forward and then swings back toward the midline in a circular movement. The Trendelenburg gait. Trendelenburg gait is an abnormal gait resulting from a defective hip abductor mechanism. The primary musculature involved is the gluteal musculature, including the gluteus medius and gluteus minimus muscles. The weakness of these muscles causes drooping of the pelvis to the contralateral side while walking. The waddling gait. The waddling gait happens because of weakness in your hip girdle and upper thigh muscles. To make up for the weakness, you sway from side to side and your hip drops with each step. It caused by hip disorders such as developmental hip dysplasia, septic sequelae in the hip, bilateral Perd's disease, and slipped capital femoral epiphysis. The lurching gait. A lurching gait is common among people affected by paralysis or weakness of the gluteus area. It causes a slow and long stride. The upper body can jerk forward or backward to lessen the weight on your affected leg. The Parkinson gait. People with Parkinsonian gait usually take small, shuffling steps. They might have difficulty picking up their feet. Parkinsonian gait changes can be episodic or continuous. Episodic changes, such as freezing of gait, can come on suddenly and randomly. It can cause, and these are the most obvious symptoms of the disease. The steppage gait. Steppage gait is the inability to lift the foot while walking, due to the weakness of muscles that cause dorsiflexion of the ankle joint. Foot drop is not a commonly seen condition. The foot hangs with the toes pointing down, causing the toes to scrape the ground while walking, requiring someone to lift the leg higher than normal when walking.